Hi, welcome. I'm Dr. Khaled Sadek, and you're watching my fantastic YouTube channel on cysts and lipoma removal. Today we'll be performing a live chat, taking live questions from our audience from around the world. Before I begin, if you're new to the channel or are interested in information about lipomas and cysts, then please either visit my website, lipomacyst.com, or watch my educational YouTube videos on the channel which cover various topics. So to begin with, I'll just have a brief introduction about the services that we provide at lipomacyst.com before taking live questions from the floor. So what I do in clinic is specialize in the removal of benign fatty growths known as lipoma, which can be present throughout the body, either an isolated lesion or multiple lesions, and we remove these under local anesthetic, the same stuff a dentist may use in providing a filling. We've also got a specialist interest in removing skin cysts. Now those are benign, epidermoid, sebaceous cysts that once again can occur anywhere in the body, from the chest to the scalp, which are called pilocysts, to the face, to the back, or the legs. So if you would like further information on the treatment of any of these conditions, then don't hesitate to reach out to us at contact@lipomacyst.com or visit our website, lipomacyst.com. So today, we're really kind of celebrating the achievement that we've had over the last, 8 months since we went live with our YouTube channel. We first dropped our first video in March. We're now coming to the end of 2019. We've produced somewhere in the region of about 50 different videos, and we've had over 12 million views, 500 million hours of reel, and about 77,000 subscribers. We couldn't do this without the support of everybody out there. So I want to thank you, wish everybody a Happy New Year and a Merry Christmas. So with no further delay, let's take some questions from the floor. Let's begin. Hello everybody. So who do we have here? Let me just scroll up. Start from the beginning. So Danny, hello. Tracy, hello. Yellow-eyed canine, hello. Rosemary, hello. Hello everybody. Sani from Germany. Marie, how you doing? Shannon, Kylie, Sandra, Jill, Shirley, Gail, everybody. Welcome, 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 welcome. So let's take some questions. The first question here is from Joy. Dear Dr. Sadek, I suffer from boils every month, and by the time my dermatology appointment comes, they've disappeared. Well, that's actually quite a common complaint. These cystic acnes that can present very much come and go. The ideal position is to try and remove them before they get infected. You've seen in a number of my videos where the cyst has been removed without infection, and it's very, very straightforward. We're able to open the skin, make a small incision, take out the cyst whole, and I'm able to close the skin, and the skin heals very, very quickly because we are treating it without the infection. You've also seen some videos where it hasn't been quite so successful. There's an infection, we've had to pack it, wash it, irrigate it, and that particular procedure is quite protracted and can last several weeks, and it's a real inconvenience to anyone who's having to suffer this. We did the Oxford cyst, which was a bruised, liquefied cyst. We were able to irrigate that with saline, close it up using a stitch. We had a good result there as well. We've got some other videos coming up later in the coming weeks, and I also promised to produce a compilation video of all the wonderful surgery and all the wonderful memories that we've had of 2019. So let's have a look. Some more questions from the floor. Hello, Canada. You're giving feedback on your mic. Yes. So this microphone. I've got a microphone here. That's what this tape is. Let me see if I can find it. Seems to have fallen. It's fallen off. So let's reattach that back on. Sorry. There we go. Sorry if you weren't able to hear me properly. So let's have a look. Some questions. Oh, it's fallen again. I'll just have to hold it. It's giving feedback. So let's have a look. So can you have a lipoma pop from a massage? Well, lipomas are benign fatty growths. That's to say they're not cancerous in any form, but they are quite large, they're unsightly, they do grow, they can be in isolation, they can occur in a number of different locations. You can't unfortunately pop them just through a massage because they're encapsulated in a nice tough capsule which needs to be broken down before the lipoma can be removed from the skin. So it's a nice thought, but you can't do it through a massage. Let's have a look. Love your videos. Seasonal greetings from Georgia. Fantastic. Let's have a look. What have we got here? Christiana, it's live. Yes. Hello from California. There's some background noise. Yeah, sorry about that. The microphone had fallen. I wasn't aware of that. Let's scroll down right to the bottom. Houston, welcome, Houston. Can you get it on your foot? Well, the most common type of growth that we see in clinic on the feet is something called a ganglion. Now that sounds pretty horrific, but in the foot there are many bones articulating. That means they're moving against each other. So that means there are well over 50 different joints within the foot, and that gives it that very dexterous mobility that you get in the foot. Now the problem with that, between every single little bone there's a capsule of fluid, and that's called the synovial joint. And you can think of that as being a cushion of oil that helps to lubricate the articulating surfaces of the joints. Now, what you can get is a weakness in that capsule, which results in a small bleb of fluid popping out. So you get this little outgrowth of a ganglion that comes out. Often, very conservative management, we tend to leave it. It can be aspirated. That means some local anesthetic and a syringe, and we can drain out the fluid. In more severe cases, it does need general anesthetic, and that's performed by a orthopedic surgeon. So it's not something we do in clinic, but the ganglion is what you tend to get in the foot, as opposed to a cyst or a lipoma. But in some people, you do get sort of ankle lipomas, typically because shoes have caused a lot of trauma, irritation, and that has caused the lipoma to grow around the ankle. Again, causing quite discomfort because shoes don't fit as well. They can be unsightly, and they are particularly tricky to remove because of all the blood supply that's in the ankle and all the underlying fascia and bony structure. So let's take some more questions. Fantastic questions. I'm really loving today. The anesthesia that uses blades to cut into blackheads scare me. Should they be removing cysts? Anesthetists that use blades. Well, I haven't seen those videos, and maybe we should actually produce a commentary on videos, and so maybe we'll do that in the future. But cysts typically need to be, excised, and that means you need to make an incision, you separate the tissue, take out the cyst, and close it. You can't just kind of simply shave it off. But there are certain kind of cysts, typically something called a neurofibroma, which is a genetic condition which results in lots of little cysts that can develop in the skin. Those often can be shaved off, but in 99% of cases, most cysts actually need to be excised using local anesthetic. So, next up. Good morning, Khaled from Merry Christmas, Happy New Year. That's from Rhoda. Hello. Janie, hello. Portugal, Margarita, welcome. Good evening, everybody. I have cellulitis from infection following a mosquito bite, and I do everything I can to prevent the bites, but nothing's working. How can I treat my cellulitis? Well, that's a very good question, Rosemary. So cellulitis is the medical term which means infection, a skin infection. Now, infection obviously means bacteria has got into the layer of the skin, and they're breeding, and it causes this red spread. You get warmth, you get heat, you get swelling, and often, if it's very small, your body may be able to fight it off. But if it's spreading, and I do recommend that people kind of use a little pen and they just mark out the circumference of the cellulitis, and then over the next 48 hours, just assess to see if it's spread beyond those margins. And if they have, you often will need antibiotics. And the antibiotics of choice for skin infections is something called flucloxacillin, unless, of course, you're allergic to penicillin. But I would recommend you seek medical advice and get those treated promptly. In terms of how to repel mosquitoes, there's a lot of mosquito repellent spray you can buy from the chemist. There's also netting that you can put over your bed or net when you are in a mosquito area. Remember to wear long trousers and socks when you're in bed. But most importantly, when it comes to mosquito, you have to always check travel advice regarding malaria, because that is a nasty illness that can kill and is born within the bites of mosquitoes. So if you're in a malaria area, you will need to take anti-malaria tablets. Next question. Let's have a look. Greetings from Jamaica, West Indies. That's fantastic. Hello, Linda. How are you doing? Can you get on your foot? Texas, Tammy. Greetings from Washington, D.C. Hi, doctor. You're great. Thank you, Sharon. Thank you for watching. I have lupus, and all under the skin, especially on the arms, are lipoma-like things. Should I have them checked? They never go away. That's from D. Rickett1. Certainly, if you've got more than one, they need to be looked at. They need to be excised, they need to be sent to the lab, we need to have a look to see the histology, and that means another doctor looking underneath a microscope. He's called a histopathologist. He'll be able to tell us the cell type, tell us exactly what is causing this, and most importantly, give us a diagnosis, and from there, we can decide what kind of treatment to provide for you. Next question, let's have a look. I've ticked like before. Yeah, well, thank you, everybody. Marie, thank you. Everybody, hit the like. Oxford Cyst was fantastic. Thank you so much. We'll be doing a lot more follow-up videos. I think that was very, very popular. We're also going to do a lot more of the educational videos, not just squeezing pops and spots, but actually going through the actual procedure, taking you through it, telling you the decisions, why, how, and when, so that you're kind of being informed as well as being entertained as well. So let's have a look, take some more questions from the floor. Let's go right down to the bottom. So, happy holidays from Danny, Team Natural. Hello. Love from Washington. Can soaking in hot water with Epsom salts help mild cellulitis? You know, I'm a great fan of the old remedies, the traditional remedies before modern medicine. And one of my favorites is Epsom salts or Dead Sea salts. They have wonderful natural properties, and you just get that salt and you let it dissolve in hot water, and you can put your foot in there, you can put your hand, and I find it has great results for eczematous skin, dermatitis, and it just helps to kind of just suck out all of those little blisters, those eosinophils, and just kind of soothe the skin, calm it down, let it heal. As for cellulitis, I think the jury will probably say if it's a bacterial infection, then we really should be going for antibiotics. But there may be a dual role for soaking those legs in Dead Sea salts as well. But you definitely need to be on the antibiotics. So next question. Are you in your office, new office? Ah, yes, I know, Bridget. We're moving offices. So today was the last day on Walton Street. So there's wonderful horse-drawn carriages coming in from the Royal Cavalry. They won't be blessing us in the morning. But we've got brilliant new office spaces, and we'll be moving in those on Monday. So we'll see what delights we have from the new office when we move to 30 Thurlow Square. So be prepared for more introductions there. Next questions. Tracy from Ireland, Christy from Washington, and let's have a look. Does keloid acne scarring go away? That's a very, very good question. I get a lot of questions regarding scarring. Now, scarring is what happens when the body tries to heal itself after it's been damaged. And as you can imagine, when you're born, you know, the layer of skin that you're given is absolutely pristine. It fits, it does everything, it's mobile. But as soon as you cut the skin, you cause damage and inflammation. And part of that inflammation, part of that battle to put everything back together, scars the ground, it tortures the surface of the skin. In fact, it tortures any surface, whether it be in the under the skin or deep inside the anatomy. So scarring is invariable. Now, some people will scar completely differently to others. So a lot of people will scar with a flat, translucent scar, which will heal neatly. And some people, unfortunately, heal with what's known as keloid scarring. Now, keloid scarring is when there's a real nasty inflammatory reaction, and what happens there is the skin becomes very rigid, very toughened, and it keeps growing. So it's no longer flat it can be quite marked. Very, very difficult to treat, unfortunately. Some of the schools of thought on that would be either to treat it using a steroid injection, and you can kind of inject the steroid into the keloid scarring, and the idea behind that, it'll kind of eat away at the keloid and let that heal. Alternatively, you can try and excise not the entire scar, but within the centerpiece of the scar, and then bring the edges together, and it produces a smaller scar. And there is obviously the option to try and go down laser therapy as well. So keloid scarring, a little bit troublesome, and invariably a complication of any inflammatory process, whether it be surgery or cystic acne. So I hope that was useful. Next question. Can you tell if a cyst is cancerous once you open it? What might be a sign, says Shannon Cohen. So I think it's always very, very prudent to send anything that you take out of the body off to the laboratory for analysis, so that a histologist can give us a firm report to tell us exactly if this is a benign growth or if it's something more sinister. You won't be able to tell just by looking at it. You will, in most cases, can tell if it is a creamy, sebaceous discharge. But in some of the more subtle diseases, like a sarcoma, it's very difficult to do so. And even under a histology analysis, they need to use special stains, like immunohistochemistry, to be able to tell us whether it's malignant or not. So in the more complex kind of cysts, you should be sending it all to histology for analysis. It's a good question. Next question. So, I have small deposits of cholesterol under my eyes. How do I get rid of them? That's Sarah Hunter. Sarah, yeah, it's a good question. So this is xanthelasmus. Xanthelasmus, that's what it's called. And that's where you get little deposits of very hyper-pigmented, isolated, small little dots. It looks like butter underneath your eyes, and they can coalesce, as in they can join together and make pools of butter. Very difficult to treat. You can try and break the skin, get the fat out, but with variable success. Of course, it mustn't be confused with milia, which is small little collagen dots, which can be treated using hyphecators. But yeah, xanthelasmus, difficult to treat. I would recommend, though, that you do get your cholesterol tested by your local family GP to make sure that your cholesterol level is normal, because sometimes the stigmata of disease, that means, how disease manifests itself on different parts of the body, can be an indication of something else that's going wrong inside. So yes, if you've got them, go check out your cholesterol, go check out your blood pressure, check out your blood sugar as well. Make sure you haven't got any underlying diseases as well. Next question. So, hello from Central Italy, Umbria. Hello, that's Rocker XX69. Pleasure watching your practice. Thank you so much, Italy. It's a pleasure watching a real doctor, says Betsy. That's too kind, Betsy. Hello from Virginia. I have to ask, on my side of my feet, I have a lump. Both of my feet have got infected by the lump, and it's getting bigger. So that's Anya. That's a difficult question, Anya, without the images. I won't be able to kind of comment on that. But if it's getting infected and you've got lumpy lesions on the feet, certainly need to go and see your GP to see what that's about. Can you get I absolutely love the fact that you don't do your pops for likes. You're a master of sac removal. I have a cyst. What's your waitlist time frame? That is Linda Parker. Linda, drop us an email, contact@lipomacyst.com. We'll be happy to see you anytime. What else is there? Just for information, I love when the show in London is during the holiday. Yeah, so we've got, Christmas all over the world. London is particularly beautiful this time of year, so we'll be out and about. We'll be showing you some real secret locations that you won't typically see on your tourist trail. So look out for those at the end of this year and well into 2020, when we'll be doing much, much more. Let's take some more questions. So Denise from Washington State. Kim says, why does when you get older? Not sure. Annie Mac, love your videos. Hi, Scotland. Dorothy, evening from Idaho. My family is from Scotland, and the doctor there says that we're prone to keloid scarring due to ethnic heritage. Are certain ethnic groups more prone to keloid scarring? Well, yes. Depends on the melatonin level. That's the pigmented level of skin. So darker skin does tend to keloid more than the fairer skin. Next question. I've had injections into hypertrophic scars. Ouch. Yeah. They did scar revision with radiation therapy, worked well. So that's whatever. Thank you for sharing that. So if anyone is thinking about keloid scarring, whatever, has tried some scar revision and some radiotherapy, which seems to have helped. I use Madrema for scarring. Yes, that's great, Denise. So yeah, there are lots of different creams that you can put on there, silicone gels, that will help the scarring. Even got from South Africa. Why do scratches and scrapes take longer to heal as you get older? I see, Gene. Okay, fantastic. Well, the body just does seem to take a little bit longer for healing in general as we age, and that's just part of the aging process. The DNA needs to replicate. It takes a bit longer. You need a bit more metabolic enthusiasm, increased nutrition, so the body does seem to take a lot longer, not just for scratches and scrapes, but even for big operations like hip surgery as well. So let's have a look at some more. Dr. K, can you tell if cyst? We've had that question. Let's go straight down to the bottom. Let's see what we've got. So we've got some more shout outs. So we've got Drummer Woman, hello from Texas. We've got Rainy Day from Staines upon Thames. We've got Shannon saying happy holidays again. Thank you so much. We've got Aisha saying hello from Paris. Susan saying, hi doc, this might be a dumb question, but what's the difference between a blackhead and a cyst? Meaning the content. So a cyst is an encapsulated skin lesion. It's got a specific cell type that causes the cyst. The most common type of cell is the epidermoid cyst, and we get these encapsulated lesions, and they produce this oily, cottage cheesy type sebum, while the blackhead is just a pore, and it's got lots of debris, dead skin, oil, and it's just got bigger and bigger. It's been oxidized by the air. Hence its color is discoloration of being black. And so blackheads are pores filling up with all sorts of grit, while a cyst is an encapsulated under the skin biological tissue surrounded by living cells that just keeps growing. So next question. Love London in the holidays. Thank you, Danny. So is there a reason to use hyaluronic acid in cosmetics? So many brands include it. That's a question from Lorraine. So the chemical peel industry is huge, and they have all sorts of different acids to just kind of remove dead skin, to exfoliate the surface of the skin. And actually, one of my up-and-coming videos will be to look at facial products, from skin peels to creams, and try and give you a bit more information as to what works and what doesn't work. So the chemical peel, it's a big industry. All sorts of meso peels and all sorts. So we'll cover those in another tutorial. So Christine says, I love your entertaining videos. Thank you for watching. Denise from Washington State. So what other more questions we've got? So, hey doc, love watching your videos from NC. My husband says I'm sick. That's Stacy Jowers. I think everybody's partner just doesn't quite understand what these channels are about. So, but she's a nurse and she loves wound care, and she really loves the show. Thank you ever so much. Next, we've got Esther from Spain. Hello, how you doing? We've got Pascal saying hello. And what is the secret for good-looking skin? Says Rainy Day. Well, that's a good question. I think, to be beautiful on the outside, we have to be beautiful from within as well, and that means looking at the whole of your physical and mental well-being. And maybe we'll discuss the general health advice for looking after yourself as a whole in its entirety, so that you do end up having beautiful, radiant skin. And that it will encompass everything from sleep to diet to exercise to having a mental space, having great food, having fantastic cholesterol and blood sugars and bowel biodiversity. So we'll cover that as well. Let's have a look some more. So, Doc, What is this? Make sure you take your vitamins. Fantastic. That's Danny. Good advice, everyone. Gail says hello. Susan from Louisiana. Drummer woman from Texas. So, I hope you found that really, really useful. Got one more. Actually, what's this? Jean-Pierre says, I watched all your videos. So interesting. Merry Christmas from France. That's Marianne from France. And Bridget Schumacher says, thank you so much for spending time with us. Guys, it's been an absolute pleasure talking to you, greeting you, taking questions from the floor. I hope you found it useful. Sorry that the mic has fallen off in my hand. But remember, if you want any advice, please watch the other tutorials in our collection. Contact us at lipomacyst.com. Most importantly, enjoy the videos. Till next time. Bye-bye.